Regenerative medicine is a revolutionary field in healthcare that focuses on repairing, replacing, or regenerating human cells, tissues, or organs to restore normal function. Unlike traditional medicine, which often treats symptoms, regenerative medicine aims to address the root cause of diseases by harnessing the body's natural healing abilities. This field combines biology, engineering, and clinical science to develop therapies that can heal injuries, cure chronic diseases, and even grow new organs. As we begin this journey, let's explore how regenerative medicine is changing the landscape of healthcare and offering hope to millions worldwide. The concept of regenerative medicine has roots stretching back decades, but it truly began to gain momentum in the late 20th century. Early pioneers recognized the potential of stem cells and tissue engineering to repair damaged tissues. Over time, advances in cell biology and biotechnology fueled rapid progress. Today, regenerative medicine stands at the intersection of multiple scientific disciplines, drawing on breakthroughs in genetics, biomaterials, and clinical research. This rich history sets the stage for the exciting developments we see today, as scientists and doctors work together to unlock the body's remarkable ability to heal itself. Stem cells are the cornerstone of regenerative medicine. These unique cells have the remarkable ability to develop into many different cell types in the body. They can divide and renew themselves over long periods, making them ideal for repairing damaged tissues. There are several types of stem cells, including embryonic, adult, and induced pluripotent stem cells. Each type has its own strengths and potential application. Understanding how stem cells work is crucial for appreciating the promise of regenerative therapies, as they offer the foundation for many groundbreaking treatments. Tissue engineering is another vital pillar of regenerative medicine. This process involves combining cells, engineering materials, and suitable biochemical factors to create functional tissues. Scientists can grow tissues in the lab that can be implanted into patients to replace damaged or diseased parts. From skin grafts for burn victims to engineered cartilage for joint repair, tissue engineering is already making a difference in clinical practice. The ultimate goal is to create fully functional organs that can be transplanted, reducing the need for donor organs and saving countless lives. Cell therapy is transforming the way we treat diseases. By introducing healthy functional cells into a patient's body, doctors can repair or replace damaged tissues. This approach is being used to treat a range of conditions, from blood disorders to heart disease. For example, bone marrow transplants, a form of cell therapy, have been saving lives for decades. Newer therapies use specialized cells to target specific diseases, offering personalized treatment options. The ongoing research in cell therapy continues to push the boundaries of what's possible in modern medicine. Gene editing technologies such as CRISPR are opening new doors in regenerative medicine. By precisely modifying genes, scientists can correct genetic defects that cause disease. This approach holds promise for treating inherited disorders, certain cancers, and even some viral infections. Gene editing can also enhance the effectiveness of cell therapies by making cells more resilient or better suited for their therapeutic roles. As these technologies advance, they are becoming safer and more precise, bringing us closer to a future where genetic diseases can be cured at their source. Biomaterials play a crucial role in regenerative medicine by providing the structure needed for new tissues to grow. These materials can be natural or synthetic and are designed to interact safely with the body. Scaffolds made from biomaterials support cell attachment and growth, guiding the formation of new tissues. Advances in material science have led to the development of smart biomaterials that can release growth factors or respond to changes in the environment. These innovations are making tissue engineering more effective and expanding the possibilities for complex tissue and organ regeneration. One of the most ambitious goals of regenerative medicine is the regeneration of entire organs. Scientists are working to grow organs such as kidneys, livers, and hearts in the lab using a patient's own cells. This approach could eliminate the risk of organ rejection and drastically reduce waiting times for transplants. While fully functional lab-grown organs are still in development, significant progress has been made in growing organoids, miniature, simplified versions of organs that can be used for research and drug testing. The dream of organ regeneration is coming closer to reality every year. Regenerative medicine has led to remarkable advances in wound healing. New therapies use growth factors, stem cells, and engineered tissues to accelerate the repair of skin and other tissues. These treatments are especially valuable for patients with chronic wounds, burns, or injuries that do not heal with conventional care. By promoting natural healing processes, regenerative therapies can reduce scarring and restore function more effectively. The ongoing research in this area is providing hope for faster recovery and better outcomes for patients facing difficult injuries. Bone injuries and cartilage damage are common problems, especially among athletes and older adults. Regenerative medicine offers new solutions by using stem cells and engineered tissues to repair or replace damaged cartilage. These therapies can restore mobility, reduce pain and delay, or even prevent the need for joint replacement surgery. Clinical trials are showing promising results, with many patients experiencing significant improvement. As research continues, regenerative approaches are expected to become standard treatments for joint and cartilage injuries. Heart disease remains a leading cause of death worldwide, but regenerative medicine is offering new hope. Scientists are developing therapies that use stem cells and engineered tissues to repair damaged heart muscle after a heart attack. These treatments aim to restore heart function and prevent heart failure. Early clinical trials have shown encouraging results, with some patients experiencing improved heart performance. As research advances, regenerative therapies could transform the way we treat heart disease and save countless lives. People with diabetes, regenerative medicine is paving the way for new treatments. Scientists are working to create insulin-producing cells from stem cells, which could be transplanted into patients to restore normal blood sugar control. This approach has the potential to reduce or eliminate the need for insulin injections. Early studies are promising, and ongoing research is focused on improving the safety and effectiveness of these therapies. If successful, regenerative medicine could offer a long-term solution for millions living with diabetes. Injuries to the nervous system, such as spinal cord damage, have long been considered irreversible. Regenerative medicine is changing that outlook by developing therapies that encourage nerve regeneration and repair. Stem cells and engineered tissues are being used to restore function and sensation in patients with nerve injuries. While challenges remain, early results are promising, and ongoing research is bringing us closer to effective treatments for paralysis and other neurological conditions. Vision loss can be devastating, but regenerative medicine is offering new hope for restoring sight. Scientists are developing therapies that use stem cells to replace damaged retinal cells and restore vision in conditions like macular degeneration and retinitis pigmentosa. Early clinical trials have shown that some patients can regain partial vision, and research is ongoing to improve these outcomes. The potential to restore sight is one of the most exciting frontiers in regenerative medicine. Skin injuries, burns, and chronic wounds are being treated with new regenerative therapies. Scientists are developing skin grafts made from a patient's own cells, which can integrate seamlessly and promote faster healing. These advances reduce the risk of rejection and scarring, leading to better cosmetic and functional outcomes. Regenerative medicine is also being used to treat genetic skin disorders, offering hope for patients with conditions that were once considered untreatable. Regenerative medicine is making strides in dental care as well. Scientists are exploring ways to regenerate teeth, gums, and jawbone using stem cells and tissue engineering. These advances could lead to treatments that restore lost teeth, repair gum disease, and rebuild bone lost to injury or infection. The potential for natural tooth regeneration is especially exciting, as it could eliminate the need for artificial implants and dentures in the future. Liver and kidney diseases are major health challenges worldwide. Regenerative medicine is developing therapies to repair or replace damaged liver and kidney tissues using stem cells and engineered tissues. These approaches could reduce the need for organ transplants and improve outcomes for patients with chronic organ failure. Research is ongoing, and early results are encouraging, offering hope for better treatments and longer, healthier lives. Regenerative medicine is revolutionizing the treatment of blood disorders and immune system diseases. Stem cell transplants are already used to treat conditions like leukemia and lymphoma. Newer therapies aim to regenerate healthy blood cells and restore immune function in patients with autoimmune diseases or immunodeficiencies. These advances are improving survival rates and quality of life for patients facing serious blood and immune system challenges. Regenerative medicine is playing a role in cancer treatment by helping to repair tissues damaged by surgery, radiation, or chemotherapy. Stem cell therapies can restore bone marrow and immune function after aggressive cancer treatments. Researchers are also exploring ways to use regenerative techniques to target cancer cells more precisely, potentially reducing side effects and improving outcomes. The integration of regenerative medicine with oncology is opening new possibilities for cancer care. As we age, our bodies lose the ability to repair themselves as effectively. Regenerative medicine is exploring ways to slow or even reverse aspects of aging by rejuvenating tissues and organs. Therapies that target aging cells, promote tissue repair, and restore youthful function are being developed. While the quest for longer, healthier lives is ongoing, regenerative medicine is providing new tools to improve quality of life as we grow older. Personalized medicine is a key trend in healthcare, and regenerative medicine is at the forefront. By using a patient's own cells and genetic information, therapies can be tailored to individual needs, reducing the risk of rejection and side effects. This approach is making treatments more effective and safer, marking a shift from one-size-fits-all medicine to truly personalized care. The future of medicine is becoming more individualized, thanks to advances in regenerative science. With great power comes great responsibility. Regenerative medicine raises important ethical questions, especially regarding the use of embryonic stem cells and gene editing. Balancing scientific progress with respect for human life and dignity is essential. Ongoing dialogue among scientists, ethicists, and the public is helping to shape responsible policies and practices. As the field advances, ethical considerations will remain central to ensuring that regenerative medicine benefits society as a whole. Clinical trials are essential for bringing regenerative therapies from the lab to the clinic. These studies test the safety and effectiveness of new treatments in real patients. Many regenerative therapies are currently in clinical trials, with some already approved for use. The process is rigorous and can take years, but it ensures that new treatments are safe and effective. As more therapies complete clinical trials, we can expect to see regenerative medicine become a standard part of healthcare. Despite its promise, regenerative medicine faces significant challenges. Technical hurdles, high costs, and regulatory barriers can slow progress. Not all therapies work for every patient, and long-term safety is still being studied. Researchers are working hard to overcome these obstacles, and collaboration between scientists, doctors, and policymakers is key. By addressing these challenges, the field can continue to advance and deliver on its promise to transform healthcare. Regenerative medicine is having a global impact, with research and clinical applications spreading across continents. Countries around the world are investing in regenerative technologies to address their unique healthcare challenges. International collaboration is accelerating progress and ensuring that breakthroughs benefit people everywhere. As the field grows, it has the potential to reduce health disparities and improve outcomes for patients worldwide. The future of regenerative medicine is filled with exciting possibilities. Emerging technologies like 3D bioprinting, artificial intelligence, and nanotechnology are being integrated into regenerative research. These tools are making it possible to create more complex tissues, improve treatment precision, and accelerate discovery. As technology continues to evolve, regenerative medicine will become even more powerful and accessible. Behind every breakthrough in regenerative medicine are real people whose lives have been changed. Patients who once faced limited options are now experiencing recovery and renewed hope thanks to regenerative therapies. From children with genetic disorders to adults recovering from injuries, these stories highlight the human impact of scientific progress. As more patients benefit, the promise of regenerative medicine becomes even more tangible. Success of regenerative medicine depends on collaboration among doctors, scientists, nurses, and other healthcare professionals. Multidisciplinary teams work together to develop, test, and deliver new therapies. Their combined expertise ensures that patients receive the best possible care. As regenerative medicine becomes more integrated into clinical practice, teamwork will remain essential for advancing the field and improving patient outcome. Public understanding of regenerative medicine is crucial for its acceptance and success. Educational initiatives are helping people learn about the science, benefits, and limitations of these therapies. By increasing awareness, we can foster informed decision-making and support for ongoing research. As more people become familiar with regenerative medicine, its positive impact on society will continue to grow. Regenerative medicine is ushering in a new era of healthcare, where healing and restoration are possible in ways once thought unimaginable. By harnessing the power of biology, technology, and teamwork, we are moving closer to a future where diseases can be cured, injuries fully healed, and lives transformed. The journey is ongoing, but the progress so far is a testament to human ingenuity and the relentless pursuit of better health for all.